All right, everyone. Welcome back to another episode of Let's Talk Teeth. Today we have Dr. James Rutkowski. Dr. Jim, if you don't mind, just kind of introducing yourself, telling us a little about your background, where you went to dental school at, where you're at now, and the unique position that you're in today.
Okay, thank you for inviting me. I appreciate it
Of
greatly.
course.
I look forward to chatting with the two of you for the next hour or whatever. And the let's see, I started out working in a pharmacy when I was in high school, and every time I left the pharmacy, the pharmacist said to me, "Jim, you're going to be a pharmacist when you grow up." And I said, "Okay, sure, Mr. Green." And every time I went to my dentist said to me at the end of every appointment, "Jimmy, you're going to be a dentist." And lo and behold, when I graduated from high school, I went to pharmacy school at Duquesne University in Pittsburgh, Pennsylvania. I graduated in 1972 from pharmacy
Oh,
school.
wow.
Then I went directly to dental school at the University of Pittsburgh, where I
Wow.
graduated in 1976. And then I went into general practice. I was an associate and bought that practice within 6 months of graduation. Enjoyed it in Pittsburgh, but my wife and I, we had two children. We spent 7 years in Pittsburgh, and we had two children and wanted to raise them in a small town. We went to a small town called Clarion, Pennsylvania, in the middle of the state, and practiced there. We raised our two children. Once they got out of college, I realized that I wasn't done going to school, even though I was 51 years old at that time. I went back to my pharmacy alma mater, Duquesne, and I said I'd like to get a PhD in pharmacology, which is something I always wanted. I always wanted
Hmm.
dental school, and I wanted a PhD in pharmacology. They were kind enough to allow me to attend the PhD program in pharmacology toxicology on a part-time basis. I funded my own research, and I put a research laboratory in my dental office in the lower level of it in our building. And I actually hired students, graduate students, undergraduate students to work in that laboratory. I knew how to do all the experiments, but I was upstairs doing dentistry while they were
Hmm.
downstairs running tests. And what I got my PhD, my dissertation was on the use of autogenous growth factors for bone growth in the oral cavity. And from
Nice.
that, when we
Hmm.
got done, I started a research company, and we came out with a product that we got patents on, and it's been a good ride. It's been a good ride. I continued to practice through all of it. While I was in my PhD program, I practiced 3 days a week. When I got done with the PhD program, I cut back to 2.5 days a week and enjoyed practice tremendously. In fact, my last 5 years of practice, I retired from clinical practice July 2020. That was in mid-COVID there. My wife and I, we actually lived in South Carolina those last 5 years, 6 years. But I didn't drive. I flew back to Pittsburgh, and then I would drive from Pittsburgh to this little town called Clarion in the middle state, where I practiced Monday, Tuesday, and a half day Wednesday. It was mostly just implant surgeries, bone grafting, etc. I did do some implant prosthetics, but that's how I ended my career. And then I sold my practice to an oral surgeon and two general practitioners. And
Wow.
they've since taken the practice and continued to grow it and have done well. And still have a great relationship with them. I just had text messaging with one general practitioner not too long ago. Of
Hmm.
course, we exchanged holiday greetings and whatnot. It has been a wonderful life for me. Because of my PhD, I've pretty much the last 20 years been associated with one university or another. University of Pittsburgh, State University of New York at Buffalo, and in Salt Lake City as well, and now Jacksonville University. And I've enjoyed having a foot in clinical practice, a foot in research, and then I guess a hand in education. Done a lot of teaching of continuing education courses. And so it's been a great life. And for those of you that are still in dental school, believe me, you are in for one of the most rewarding careers that you could ever have. I know that there's many things that are rewarding, and dentistry is I don't want to make it sound easy. It's a tough job, but it's ever changing. Every patient is always different, and even a re-exam patient is like a new patient because situations change in the oral cavity. I personally would not change one thing about my education, my worked as a pharmacist and then as a dentist, then as an educator and as a researcher, and now as director of the Jacksonville University Comprehensive Oral Implantology program. So happy to see the two of you, our D3s, soon to start D4, and you're just in for a great life, and all those that are tuning into this podcast. I'm not saying you won't have a hard day here and there, but the rewards of when you give that patient that mirror and they smile, especially when it's an implant case and they went from a terminal dentition to where now they have fixed teeth and they smile with confidence, they're going to be able to eat with confidence, or even if it's just a class 4 composite on number 9, and you show them that mirror, and man, because teeth mean a lot to people, and there's nothing like having a beautiful smile and good function. So you're in for a good life.
Dr. Jim, we appreciate your story. It's unique, of course, and it really is motivating knowing that you don't really regret anything. And I think me and Saad kind of resonate with your story a little more specifically. We both actually, when we started undergrad at Ole Miss, we both got into the early entry pharmacy program. So we were both in pharmacy, doing pharmacy classes, and we both just decided we wanted to do dentistry as well. So similar story in a way. We didn't go the full stretch.
Yeah, we didn't get the PharmD, but we did start similarly.
Exists.
Yeah.
But we really do appreciate your story.
Whatever education you got while you were in your PharmD programs, believe me, it will pay you dividends, because having an understanding of pharmacology is so important, especially with the age group of the patients. Everybody's living longer. People go to the dentist longer. And for those of you that do get into implantology, your patients are 60, 70, 80, 90 years old, and they will come to you with a multiple systemic pathologies, and then they will reach in their pocket and they will take out a piece of paper, 8.5 by 11, 12 font, top to bottom, with medications. And the top 25 medications prescribed in 2023 all had an effect on oral health.
Wow.
That's interesting.
So it's not just a medical history and somebody wrote something on there. There is something there. Many times it's of no consequence, but at the right dose, route of administration, or duration of use, it can have an impact on what we do in dentistry.
That's interesting. Dr. Jim, we appreciate that. And our listeners, including Saad and myself, you mentioned Jacksonville some. Do you mind sharing a little bit about how that got started and how you're involved with Jacksonville and what our listeners can benefit from knowing about Jacksonville?
We had some great founders of the program. Dr. Hilt Tatum, who passed about a year ago, Dr. Duke Heller, who is still with us, Andy McConnell, Shane Sammy, and a few other people that started an organization called CORF. And that was a foundation that was for comprehensive oral implantology that funded the start of the program. They raised over $1.1 million that got the program started with the university, because when you're starting a program, I have no idea how many residents or students you're going to have. And the first few years are just losers. So they had to have money to keep it going. So a tip of my hat to Dr. Hilt Tatum, Duke Keller, Andy McConnell, and Shane Sammy, and others that were part of CORF that got the program started, because they were pioneers in implant dentistry. All of those individuals were friends of mine. They were mentors of mine. In fact, Duke Keller and I, this morning, we exchanged text messages, and I'm still very close. They started the program, but none of them really had a lot of academic experience. And it became evident after about a year and a half that they needed to have somebody with academic experience. At that point, I was retired other than lecturing. I'm editor of the Journal of Oral Implantology, which is the peer-reviewed journal for the American Academy of Implant Dentistry. And I was quite happy to be being an editor. It was great. I'd come in my office, I'd review papers and get my publication, and then I'd go out and lecture maybe a couple times a month. And I was quite happy doing what I was doing. They came to me and asked me if I would go over as director of the program. And I said, thank you for thinking of me, but no, I'm quite happy doing what I'm doing. I'm retired and I get to
Hmm.
do a little bit of work, and it's quite all right, some travel. It's a good life I have, but thank you very much for thinking of me. And they went away and they came back in 6 weeks. They said, did you think about it? And I said, what do you mean think about it? I said, I thought that decision was made. I thought
Hmm.
I said no. And they said, did you change your mind? I said, no, I didn't change my mind. And they said, okay. And then another 6 weeks went by, and the dean of Jacksonville University College of Health Sciences called me, and the dean and I, Mark Tillman, Dr. Tillman, we just hit it off, and it was a great conversation. And my wife could hear it in the background, and she got off and she said, you aren't going to take this, are you? And I says, I could work with this guy. And I said, I think I'm going to take it. Yes, I'm going to take it. And I decided to take it, and it's been very rewarding for me emotionally to see my residents grow. We've graduated one class. We'll graduate a second class. It was originally a 3-year program. The second 3-year class will graduate in May.
Hmm.
The third year class, which is where we transition to a 2-year program, will graduate at the end of August. And then thereafter, our fourth class and whatnot, they will graduate at the end of May. We're about to bring in our fifth class this July. And I got involved with them, I guess it was maybe midway through the second year. So I've been with them almost 3 years now. And I enjoyed it tremendously. The challenges, some major challenges brought forth to us, but we've been able to rise to all the challenges. I have a great staff. We are lean, mean. I have 2 admins with me, a person named Angela and a person named Jasmine. And between the 3 of us, we're able to work very efficiently. I have very dedicated adjunct professors who teach the didactic classes for us. And then I also have very dedicated clinical directors spread throughout the country at all the residency sites who work day to day and moment to moment with all of the residents. So it's much bigger than me. It is a true team effort, and the residents are team members. And my senior residents, they do help do a great deal of the teaching for us as well.
Hmm. Man, that's awesome. And it's very interesting to hear about how you initially were going to turn it down until the dean of Jacksonville's health science just came and it's like, hey, and then had a conversation. And then next thing you know, you're taking it on. And by no means is this an easy endeavor. So kudos to you for being pretty much semi-retired to come back in and establish things the right way. And it seems like y'all got a great thing going. For the listeners who are listening who are hearing about all this but don't really know about Jacksonville University's oral implantology program, do you mind just the whole overview of what this program is, what it can bring to, say, a dental student or a young dentist who's interested in implants, but they're not sure if they want to do as a residency? How does Jacksonville's program fall into a person who's listening to this who's interested in this program?
Thank you. It'll be a pleasure to talk about it. I love this program. Let's see, it is a 2-year program, full time. The residents are what we call associate residents. They are in implant directed dental practices where the concentration is dental implantology at the practices that they are in. Some of them are in 501(c) nonprofit clinics, but even at those sites, they are directed towards dental implantology. And the sites are all over the United States. I think that right now we have 26 or 27 sites. Some sites have multiple residents, which is really great because you get to go through the program. You usually have a senior resident, 2 or 3, and some junior residents, 1, 2, or 3. So that's really neat. It's a great learning environment. Although those that are just in individual practices as solos, they still learn a great deal. They are associate residents. In other words, they go in, they are paid a minimum of a $50,000 stipend for 3 days worth of work. They can then go out and they can still have a life, have a family. For those that have children or spouses or want to get married and whatnot, you can still do that and you can still make a decent living. I know $50,000 isn't much, but that's for 3 days a week. Then you can go out and freelance the other 2 days a week as an associate somewhere else. Or in that practice that you're at, you can stay there for 4 or 5 days a week if they desire to have you there. And then we recommend, we don't dictate, but we recommend then that everything over $200,000 in collections less lab fees that the associate resident gets paid 30%. So many of our residents make anywhere from 80 to 150, 175. I just had one resident that was making $250,000 a year in their clinic. So now that's not everyone. That's not everybody to misinterpret that statement.
Yeah.
But there are each site pays a little bit differently. But you go in and you start by assisting the director, which is usually the owner of that practice or the manager of that practice, in placing dental implants, doing bone grafting procedures, surgical procedures. Start out as a number 2 assistant, then move into a number 1 assistant, and then you eventually begin to do the procedures guided with that director looking over your shoulder, and then eventually you're doing them unguided. We work on entrusted professional activities, of which we have 89 of them. Part of those 89 are that in the first year, you get your IV sedation training, so that usually by the end of your second year, you're ready to be applying to your state board of dentistry for your IV sedation permit. And we're very glad to say that we have the most vigorous IV sedation training program, conscious IV sedation program in the United States. It is accepted in all 50 states. Not all IV sedation programs are. Ours is. And that IV sedation training into itself probably has a value of, depending on where you go to take it, from anywhere from 20 to 27, 28. And yet our tuition is $37,500 per year. So that first year you get an IV sedation program that you would pay $20,000 for and not get any implant training. So anyway, you work in the clinic. I attend staff meetings. You do number 1 EPA is that you get a good medical history, good pharmacological history. You do a treatment plan, presentation of that treatment plan, acceptance of that treatment plan, informed consent. There's 12 competencies under that first EPA. Now, we want a volume of work. We don't want just one and done. We don't want you just to do one of those. Of course, that's going to be the basis for every other implant case you do throughout the program. So you might end up doing that number 1 EPA 200 times. But your director you keep a record of it on a sheet, and your director will sign off on it and check a box that says, when you're ready to do it by yourself the next time, he signs it and checks that box. But you, as the resident, have to also sign off and check the box that says you're ready to go do it for yourself. So it is, does somebody else have the confidence that you can go in and do it? And then also, do you have the confidence to go in and do it? And again, it is a volume of work where it's not 5 dentures before you graduate. This is, you're going to do them until you know how to do them. And this is what you do all day long, 8 to 5 or 6 or 7. This is what you do. And the program is demanding. It's fun. I'm telling you what, if you like learning and if you like dentistry and if you love implant dentistry, you will love this program. Our residents, they're just bubbling over. We have a special class this evening that is just a special one thrown in this evening that we are going to have a tremendous turnout for. In fact, as soon as I get done here, I have to go to teach that class with them. Sunday nights, our didactic classes are Monday through Thursday, 8 to 9:30 Eastern Time, but they're all recorded. Do your classwork asynchronous. There are reading assignments. There are some homework assignments. There are quizzes. Some have midterms. Some have final examinations. Some consist of a project like a capstone project, so that at the end of the program you have a volume of work to show, of which one of that pieces of volume of work may be a paper that's ready for publication or presentation to do at a scientific meeting, or have your cases ready to present to the American Board of Oral Implant Dentistry for board certification. And I will talk about that a little bit more going forward. Monday through Thursday, 8 to 9:30, asynchronous though. On Tuesday nights, it's a class that I teach. We have roundtable where you present your cases, and obviously if it's your turn to present, you've got to be there. But we usually have a very robust turnout on Tuesday nights for that, because the discussions on how to do these implant cases Junior residents are learning from senior residents. Senior residents are learning from each other. Senior residents end up helping teach the junior residents. It's just a tremendous learning experience. And I practiced implant dentistry for probably 35 of my 44 years, with 20 of it being principally only implant dentistry.
Mm-hmm.
I'm board certified. Yet I'm going to tell you what, every Tuesday night I learn a bunch by hearing everybody's presentations. Then on Sunday nights, we have a special topics. It is either study classes for the conscious IV sedation or special topics in implant dentistry. That is a no charge, no credit course, but we get a tremendous turnout for Sunday nights as well. So our residents, it is user friendly, where I'm a big believer that we have to be very respectful of the resident's life. I do my best not to waste any young person's 1 minute of their life, because every minute that you spend in achieving and doing and learning and accomplishing something now will pay you huge dividends when you're my age. And so I have grandchildren that are your age, and I don't like anybody wasting their time, and I don't want to waste anybody's time. So we really do try to make it enjoyable, make it fun, but it's flexible. Where that some residency programs at universities in the code-approved programs like perio-pros, oral surgery, and whatnot, they're pretty rigid. And I'm proud to say that many of our residents are, and not one of our residents has gotten a divorce yet. Okay? And I don't know of any that
Hopefully that record will continue.
Yeah. And because, that's one of the prices that people pay for when they go into some of those residency programs. Is one, they have tuitions of $80,000, $100,000, $120,000, where ours is $37,500, and you can work on the side. It is considered a full-time program. It's working towards getting implant dentistry as a code-approved specialty. It is an approved specialty by the American Board of Dental Specialties, of which you can advertise your credentials in, I think it's 38 states or something now. But in your MS degree, you get an MS degree and you get a Master of Science in Dentistry, parentheses, Implantology, Comprehensive Oral Implantology, and you're allowed to advertise that on your letterhead and on your sign and everything, because it's an earned university accredited degree, accredited by the Southern Association of Colleges and Universities. I think the program is right for young people, because you go from coming out of dental school and getting able to get right into implant dentistry. Now, depending on where you come, I have some people that have been out practicing 5 years and they come back and decide to get into it. And maybe they've already placed 500 or 1,000 implants. But we accommodate the program, and your site director accommodates that learning experience to match you. We'd like you to have all 89 EPAs done within 2 years. And that's when the didactic courses end, is in 2 years. But if for whatever reason you have not completed your EPAs, you get 2 additional semesters at no charge to complete your EPAs. If you hang around for 3, 4, 5, the university does have a fee for that. You can't hang around 6 years. They don't want people around that long.
Yeah.
But sooner or later,
you got to get out in the real world.
Yeah, we make it very user friendly. One of our residents graduated last year and placed over 1,000 implants in the residency, and restored over 1,000 implants, and managed all the post-operative and post-prosthetic complications, and followed them through 3 years of re-exams. Now the program is 2 years, though. So,
well, thank you for sharing, Dr. Jim, about it all. It's super unique, and I think that, me and Saad being Mississippi boys, just hearing all these things, it's unique knowing that there's these opportunities out there, and we're happy to learn more about them. And I'm sure our listeners are. A few questions I had regarding to the program is, how do applications typically work? Is there deadlines? And then also, I know you mentioned that there's multiple sites. Do applicants have preferences to sites, or is it does it kind of like a draft, like the NFL draft? How does that work towards the program?
The deadline for admissions is May 15th for a July 1 start. But if a practitioner has experience, of some kind, Maybe they've been out of school for 2 or 3 years. Maybe they do GPR residency. Maybe they're coming out of the military and whatnot. We are just instituting this next year. We haven't done it yet, but we're instituting it for next year that they can come in July, September, or January start
I
dates.
see.
Okay.
Oh, wow.
Now, those coming out of dental school, we would like them to stick with a July start date because we have an orientation class in the summer separate from the regular tuition. That is a $3,750 tuition for that. It's a 2-week long orientation period. It's got a lot of medical evaluation in it and aseptic sterile technique for use in dentistry and whatnot. It's a pretty intense 2 weeks of training for it that your director has to let you attend. Although they are recorded, so if you can't make the Tuesday class, you certainly can. They're in the mornings for 4 hours.
Mhm.
But it is a match process. We'd like you to have your application in. The sooner the better. It is first come, first serve, competitive. Okay. And those, I'll be quite honest with you, those getting their application in like in April and beyond, they're simply told you've got to wait till next year because everything is filled. Limit the class size to 25, although last year I did take 27. But I did turn down probably 10 or 15 people. And I said, your application is there. It may be a very strong application, but you got it in late. So the sooner you get it in, the better. We'd really like to have them in by December 31st this year. So for this year, we want it in by December 31st, 2025, which is a little bit later than perio-pros, oral surgery, those CODA-approved programs at other universities. Then, let's see, the match process. Once you get your application in, and you need transcripts and everything, all that kind of stuff, you get all that stuff in, and then we reveal to you where all the potential sites are for it. Where we ask you, where would you like to go? And you say, I'd like to be in southeastern United States. So then we give you all the sites that are looking for residents in the southeast United States. And then you say, you know what, I like Tampa, I like Miami, and I like Atlanta. Okay. So then what we do is we ask you to pick your top 5. Then from that, we go to our map and we see, okay, we've got this person, his top 5 were those 3, 4, 5 cities. Then we you make a recording, you have an application, and you write a paper of why you want to go in implant dentistry and a video of why you want to be in implant dentistry. And then that gets shipped out to those 3, 4, 5 sites, of which the clinical director, then they get like maybe 5 or 10 of those, of which they look at them and they say, we like number 1, 2, and 5. Okay. And those 1, 2, and 5, candidates 1, 2, and 5 set up a phone interview or a virtual interview with the clinical site. And if it goes well, then they are invited to do an on-site visit, which we like it to be for 1 or 2 days. And then after that, the potential resident says, yep, I like my second choice the best. I want number 2. And then we let the number 2 site know that the resident would really like to go there. And then they have the ability to accept or reject the match. If you don't like any of the matches we give you coming out of the box, then we say, okay, if you will expand and consider Lexington, Kentucky, Chicago, Illinois, Washington State, California, wherever. And we almost had a site in Huntsville, Alabama, where I'm at. I think that next year we will have them on board. They had to do some things to qualify for us at this point in time. But everybody that it is competitive, and everybody that met the competitive cut did get matched. They just may not have got their first site. You have to have a little bit of flexibility and being willing to move. But if you say, look, I want to stay in Jackson, Mississippi, we don't have a site in Jackson, Mississippi at this time. But if you know of a clinician there or a practice that does a lot of implant dentistry, maybe it's an all-on-X dental clinic. Some of the affordable denture sites do a lot of, we're very tightly aligned with affordable dentures. Some of the sites do a lot of implants. Those sites then we can approve and somebody can begin the residency at one of those sites. So if there's not one where you want to be, I'm not saying we can get one there, but we would need your help, and we may be able to find a site there for you, a
Mm.
private practice or a 501(c) clinic.
Yeah. Based off the just type of application that it is, it seems very accommodating to, I think you said it best whenever you're saying you don't want to get in the way of y'all's residents' lives. And
Yeah,
even the way that y'all are matching, it's very accommodating to the applicant. They even have for a regular match somewhere, you have to go there. There's not an option. If you don't accept it, then you basically get barred from that specialty. But at least for here, it seems very y'all are very open to working with the applicant. That being said, I did have a question about what type of applicant is y'all's ideal applicant? Is it someone straight out of dental school with an interest in implant dentistry, but that hasn't really had many experiences? Is it someone who's finished up a GPR or has been working for a couple years? I'm sure y'all have seen all those, but what is this program looking for specifically? I know
I
that's broad, and we can't
yeah.
say specifically, but just in general.
Yeah, our number one preferred applicant, the ones that perform the strongest, are those that are coming out of AEGD or GPR residencies, or PROS residence, or perio residency, or an oral surgery residency. Because this is the
Mm.
most comprehensive. You get more implant training in our program than you do in oral surgery, perio, or PROS. I'm not saying that they don't get implant training. They certainly do. This is certainly more intense didactically and clinically. But we do usually accept a couple of recent graduates every year. Now, they're pretty strong. They interviewed strong. And I don't want to discourage anyone from making an application, because you learn a lot in making the application. And we do hold those that we do not accept over for the next year, and they get preferential treatment. We begin our match process October 15th. So those
Mm.
individuals, they would be first in line to go into the match process if we felt they were worthy. If we feel somebody's just not doesn't have it, then we just say, look, we think you need some more experience, and then maybe come back and visit us in a year, 2 or 3 down the road. But we usually do accept 2 or 3 recent graduates each year. And these individuals, they hold their own, they work hard, they study hard, and their start might be just a little bit slower. But let's see, this is March, and I have a couple of recent grads that started in July 1 of last year. And man, these guys and gals that met that criteria, they are doing beautiful cases now. They may not be the most advanced cases to those EPAs. So you start out with just that diagnosis and treatment planning, and then you move on to placing an implant in a healed ridge of adequate height, width, and quality of bone. Then maybe a single implant in the aesthetic zone. Then a single implant in the posterior maxilla that does not need a sinus augmentation.
Mm.
Posterior mandible. Then you will do posterior maxilla needing either crestal approach, and you'll have to do both: lateral window sinus augmentations, mandible, lateral vertical augmentations, multiple implants in the aesthetic zone, all on X cases. So you're putting in 4, 5, 6 implants and delivering an immediate prosthesis. We're heavy in prosthetics. You have to do all the prosthetics as well in the program, both
Mm.
digital as well as analog. So when you come out, you know how to do both digital and analog. And then with the more complex zygomatic implants and pterygoid implants. Not every site does all those. And if your site doesn't do those, then you go and travel to a site that does do them. You're not going to get to do them because you're not going to have a license in that state, and they're not going to trust a patient with that advanced. But you will be able to observe or assist. And then you write a paper of 1,000 to 1,500 words, and then you sit for an interview with me, just so I'm sure that you do understand that procedure.
Yeah.
That's awesome. Yeah,
So,
it
yeah,
really does seem like y'all this program seems intense, but it doesn't seem like it wastes time. You know, it doesn't seem like there's anything
yeah,
that just is busy work. It's all catering towards like being efficient and learning things that matter, which is unique and kudos to you for being a part of an organization like that. A question I had, Dr. Jim, is should residents expect the same type of training in every site? Or I know you mentioned it's a little different, but what does it typically look like? 50 implants, 70 implants, or just multiple? Do you mind elaborating a little bit on how the sites work?
Yeah. EPAs help standardize all the different sites, okay? Because everybody has to do the
I
EPAs.
see.
And again, if you don't do something, then you go someplace else. But most of the routine things, and when I say routine, the all-line access and all that, all of our sites, we've got good sites now. I must admit, in the very first year, they had some sites that were maybe just a little weak. They weren't real strong. But now our sites are strong. And so they are all pretty much the same because of the EPAs. Now, there are some sites that are doing 500, 600, 700 implants, and there's some that are doing 200 implants. But even those 200 implants, they're still getting a tremendous amount of experience, and then it's diverse from anterior, posterior, augmentations, socket graftings, all of those
Sure.
things. Every single one of those are in there. And anybody that has an interest in the program, let me know, and we will provide names of some residents that you can reach out to. Because my residents, they're willing to talk to any and everybody about this. They're enthusiastic about it. There's nobody that I would hesitate to give their name out. Everybody is
Just bought in, it seems.
yeah. Everybody's bought into the program. Yep, they're in on it. Yeah, the EPAs help give that standardization. Can I say that everybody's going to get the exact same number of implants? No, and a lot of it's what the individual puts into it. The more they buy into it, and you're going to be getting your own patients in that practice, they're going to be assigned to you as an associate resident. We got to diagnose the implants. You got a treatment plan for the implants. You got to learn how to present implants. And we've got some veterans because we have what we call a remote residency program that involves people that are already ABOI diplomates. I have a tremendous amount of experience, and they love to mentor my younger residents. But they wanted to get that master's degree. They wanted to get more didactic education. And they want to be part of Roundtable and see what other people are doing because they learn. And they will help younger residents learn how to present cases to get case acceptance. They do have a practice management course. It's at the end of the program, and one that involves legal ramifications of implant dentistry for practice and how to build practice with multiple sites.
Mm-hmm. Like Victor said, it seems like the program is it's a lot. There's no going around that, but everything that seems to be presented is very applicable, very real world. So kudos to y'all for first even thinking about something like this. To be honest, for those of y'all who haven't listened, Dr. Jim has a podcast with Soren and Tyler on the Fix podcast. They're good friends, and it's a great episode, and I recommend everyone check it out. But you talked about it on that podcast, and I was just a listener on that one, and I was just amazed. I couldn't even believe that this was a thing that was possible for students and clinicians themselves to be a part of. Kudos to y'all for even having this idea and for creating a comprehensive system as it is. And I think it's really incredible, especially for someone who's in an implant dentistry. You get everything that you could possibly want from, like you were saying, remote anchorage, zygomatics, pterygoids, to all on X, single cases, lateral windows. Anything you want is factored into the program and is taken into consideration. So that's really cool.
One of my graduates who's graduating in May, he was in the hybrid program going from 3 to 2, so he's 2 2/3 years because it switched from a 3-year to a 2-year midway through it. He actually interviewed with a major dental school oral surgery department in the United States to bring him on as faculty, and it looks as though they will be bringing him on as faculty in an oral surgery department because they want to bring implants in, and they don't have anybody there that has the implant training of surgical and prosthetics that this individual does. That school does not have any specialty programs. They have an oral surgery department, but it's just to teach the undergrads. And so those individuals that are there, they don't necessarily have a great deal of implant training. So it's gaining respect by the existing specialties around the country also.
Hmm. That's incredible. And that just goes to show how far and how well respected this program is. So kudos to y'all.
Thank you. That's very kind of you to say
Yes,
that.
sir. But I had a question about, so you had mentioned even in the past couple, as far as next year too, y'all are expanding clinics. How is that working? Are y'all reaching out to these all on X clinics and asking if they want to be part of the residency program, or how does a existing doctor get involved to bring residents to their clinic?
At this point in time now, we have individuals that have heard of us. They're reaching out to us and say, how do I get an associate resident? Okay. I did very little recruiting of new sites this year. We've got an overabundance of sites that said that we'd like to keep our class size to 25. I will have more sites requesting residents than 25 this year. So we have to take a look at our own internal manpower and say, can we do more than 25? Because I've got 2-year programs, so I've got 27 from the year before, and I bring in 25. Am I capable of handling that many? This year I do have 46 because I had some flying over from 3-year. At the moment it's 46. But we went from having a class size of 5 and 7 our first 2 years to where last year we did let 27. We did
Yeah.
27. If individuals are reaching out to me and they're saying they either know me or they saw us on a podcast or I go out and do these CD courses, they come to me and they say, hey, how do we get involved in the program as a director, but also as a resident, and whether it's a full-time in-house resident or whether it's a remote resident for those that are already well experienced being a diplomate of the ABOI or oral surgery period pros. But they're coming to us now. We actually have no external marketing. And so I appreciate the fact that you folks would invite me to come and speak to you, because I'd love to have more people talking about the program, and that leads to more applicants. The more applicants we have, the better the applicants we're going to have and the better program that we're going to have. And who knows, maybe someday we would accept 30 or 35 in each class. But just as if you wanted to be in Jackson, Mississippi, you've got an interest in a program, and we'd say, okay, make your application. And I got to stay in Jackson, Mississippi because my wife has a job, my spouse has a job there, and that's where we've got to stay. And we're not ready to uproot our family. We have children and things of that nature. Okay, great. So you look in Jacksonville, Mississippi, there's got to be somebody in Jackson, Mississippi, I would think, even though I've never been there, I would think that there's a practice or two that does a lot of implants, and maybe they are oral surgery period pros, all on X. Maybe they're a diplomated American Board of Implantology. So then you would learn about the program just as you are now. Then you would go and knock on their door and say, look, I would like to become an associate resident with you through Jacksonville University. And what that means is this, and we have information that you can give them. We give you the topping points. And then we say, if you would consider it, and I'll be quite honest with you, when they hear that it's a stipend of $50,000, 30% after $200,000 less lab fees, they're pretty much interested.
Yeah, I was about to say.
You know.
Yeah.
And quite honestly, I was in private practice and I had associates. The first 3 to 4 months of new associates coming out of school, the owner is, they're not making, ticket yet.
Sure.
Patients don't want to go to him. He looks awful young. He's new. People are nervous.
Right.
They go to give an inferior alveolar and their hands shaking. I don't know. How many of these have you got?
You're calling me now. I don't appreciate it.
It's okay. We were all there at one point in time. And then your hands will settle down. Then you will reach a top point where you're as old as me. Then your hands start
And then
shaking.
it reverts back to the shake.
Back to the shaking. But by the time our residents are there for 4 or 5 months, man, they're carrying water. And then most of my new resident directors, by the time they get that first resident on board, and they've been on board for 10, 12 months, I'm getting a phone call. Can I get another resident for next year? Not that they want to get rid of this one. They see, man, how well this works. Now, I do require that they don't treat you as underpaid labor. They
Mm.
are there to teach, and they are there to give you implant training. And yeah, somebody comes in and they have a crown that came off. You might be re-cementing it, you might be prepping it, but you know what? It's an opportunity to see that patient, and maybe it's off at the gum line, maybe it's subgingival, maybe it's an implant. And it's an opportunity for you to present that implant. And then, if what we suggest, because we have agreements with multiple implant companies, with bone grafting companies, digital companies, hardware and software companies, that give discounts to our residents and our resident directors for being in the Jacksonville University program. The prices that like Maxius gives us on bone grafting materials is just mind blowing.
It's unreal. Yeah.
Yeah, it really is. So they may present that case, and maybe it typically has a fee of, we'll just say $15,000 is what the normal fee would be in that practice for that case. If the patient says, man, that's a little steeper than I want, then they can say, we have a resident do the case for $9,000. That's how a lot of the residents get their cases. And,
That's awesome.
they do
Yeah.
it under the supervision of that director, and they get to say that they're clinical adjunct professor with Jacksonville University, which is always good for their resume. And they get to attend all of the classes that you attend. They get to watch all of the recordings that you watch. They don't get to go to the IV sedation class, but they do get to go through all our prosthetic classes, all our surgery classes, all our medical evaluation classes, every class we have, our practice management class that we have, our legal class that we have, everything that we've got, they are welcome to attend it either live at the session, the roundtables, they can be part of those, the Sunday nights, they can be part of those, or they can watch the recordings if they wish to. We offer 1 or 2 CE courses every year, and they are allowed to attend those CE courses for free. So they can get some of their
Man.
CE through those programs. So that's what's in it for them. Plus they get a good young doctor that they can help mold. And right now, I have 2 practices where my resident ended up buying
Oh,
that
that's awesome.
practice.
Thank you for sharing all
Dang.
that, Dr. Jim. I mean, you learn something new every day, but I didn't think we would learn this much about y'all and how y'all operate, and really just how like I mentioned earlier, every category is catered towards learning and growing and being better. And it seems like, just based on talking to you too, it's intense, but also a fun environment. And I think both of those are important to keep things going and to really enjoy what you do. So we really appreciate the way you've presented your program. As we're wrapping up here, Dr. Jim, do you have any final advice for dental students or new grads in general who are interested in implant dentistry or just dental advice in general overall?
Appreciate each patient for the important person they are. Every patient is hopefully important in somebody else's life, but you will do your best in clinical practice if you make each patient feel that you see the importance in them, okay?
Mm.
And never sell a patient short. In other words, they might come in and their clothes might be all scruffy and their shoes might need a shoe shine, and they look pretty bad and they look pretty scraggly. And don't judge them. Don't think, oh, this person would never be able to afford a higher level of dentistry and I'm not going to waste my time, because I found in my life that you should never judge anybody. Never judge anybody. And that's just a good rule about life. Don't
Mm.
judge. Be open. Try to learn from everybody. Learn from people. Look them in the eye when you talk to them, when you're doing your case presentations. Let them know that what you're presenting, there's various degrees of options, and you don't care which one they take, but you do want to help them. You want to know which one's the best for them, and you will help them make that selection if they don't automatically know which one it is. But obviously, the higher level the case, the more satisfaction you're going to tend to have with it. Okay.
Mm.
And if you do present implants and they don't take them today, I promise you, next time when they break a tooth in 5 years, or maybe they get that partial, or maybe they get that denture, or maybe they get that fixed bridge. The next time around, if you treat them right with sincerity and honesty and respect, the next time around, they're more apt to get that dental implant from you. And every time somebody comes in for a recare, a re-exam, treat them as though they're a brand new patient seeing them for the very first time. Don't prejudge them. Don't be happy to see them. Actually bring them back to recall. I mean, that your mental recall and something about them and how their kids are and all that and whatnot. But you got to look at them with a new set of eyes, because something is probably, maybe not, but a very good chance something is different in their mouth since the last time you saw them 6 or 12 months ago. And there's a tremendous amount of opportunities to give them the best oral health that they can get and want. And you be that provider for them, not just another number.
Sure.
I got to get you in and out of here. So,
That's
Right.
awesome. Dr.
Yeah.
Jim, thank you
yeah.
for sharing that. And first of all, sharing your story in the beginning. That's a unique story. I feel like not many people in dentistry have that story. So we appreciate it, and we know our listeners do too. And we also appreciate you going into depth about your program that you're guiding, and it's very unique. And Saad and I both got a lot ourselves, and we really hope our listeners listened to you closely and understood that you take this program very serious and you really want the best. So thanks for today, man, and we really appreciate
You're welcome. I don't know whether
Yes,
you
sir.
want, if in the chat there, or however you want to do it, if you want to give them my correct spelling, my
it.
name,
Sure,
my phone number, they can text me. If they call and they're not in my phone, it's not going to ring because of spam
sure,
blockers. They can text me. They can text me their contact card, and then I can just click on it, and it gets in there. Then we can call, or we can set up a time on text to talk on the telephone.
Yeah, absolutely.
Email, it's okay, and you give me the JU email. I'm just like you, man. I get far too many emails, and
Right.
just you guys sent me an email, I think last Friday, and I could not find
right,
it.
Yeah.
Life, whenever it was,
sure.
but the emails almost become
Yes,
Yeah,
sir.
enough said.
so,
Yeah.
yeah.
Dr.
So
Jim, I just want to thank you again for your time. I do want to say your enthusiasm is so contagious. Even talking about your journey to dentistry and how passionate you are about dentistry in general and how excited you are for us as dental students, and just talking about your program, I just see I see a light. Your eyes light up when you talk about it, and it it means a lot when someone says dentistry is rewarding, but it's another thing to see it. And the life you're living and the things that you're doing and the way you talk about your program and dentistry and Jacksonville is very apparent for anyone who's listening to this to see that. So I really appreciate that passion. And I mean, man, you're incredible. You made this program into what it is. And I think that you deserve your flowers for that. So kudos to you.
thank you. So you guys, here you are, your undergrad students or undergrad dental students. You've got a podcast. Man, that's fantastic. I got to salute you for what you're doing. You're
Appreciate
going
it.
to do
Yes,
well.
sir. When we have unique individuals like you on our podcast, this is reminds us of why we do it. And I think our listeners will get a lot out of this, and they've learned a lot about Jacksonville University and you as an individual. And the fact you're even willing to give your phone number out to just the internet is just a testament of who you are. So thank you for this conversation and thank you for everything.
You're welcome. You're welcome. You guys have a great evening. I've enjoyed this
Yes,
All
sir.
right,
conversation.
Dr. Jim.